Good afternoon, everyone. I'm Trevor McPherson, President and CEO of the Mississauga Board of Trade. It is our great pleasure to have you join us for today's webinar. We're calling Welcome to 2022, Peel Public Health and Workplace Updates on COVID-19. Although we are gathered here virtually today, I would like to acknowledge that we are doing so on the treaty lands and traditional territory of the Mississaugas of the Credit First Nation and the traditional territories of the Anishinaabe, Haudenosaunee, Wendat, and Huron people. We also acknowledge the many First Nations and Indigenous peoples, including Inuit and Métis, that call Mississauga home. We also commit to identifying ways in which we can make a meaningful contribution towards reconciliation with Canada's Indigenous peoples. I also want to acknowledge that today is Bell Let's Talk Day, and an important day to focus on mental health issues, as is every day, and support the very significant financial contribution that Bell will again make based on the number of texts and social media posts using Bell Let's Talk hashtag. We've come a long way in accepting that mental health is health, and as employers, we should do all that we can to support this fact as we consider the health and well-being of our own teams. The pandemic has not only been a public health crisis, but it has also had a major effect on mental health in our business community and the community at large. So please consider supporting Bell Let's Talk to show your support of this important initiative. Now on to today's agenda. There is no question that public health is inextricably linked to business and economic outcomes. We're living that reality and have been for almost 2 years. During today's webinar, we will be updated on the current COVID-19 situation and ongoing public health issues from Peel's Medical Officer of Health, Dr. Lawrence Lowe. We will also hear from Jonathan Borrelli of KMB Law, who is here to discuss ongoing concerns at workplaces, including vaccination policies and best practices for reopenings, as well as other pandemic-related employment matters. Today's webinar is presented in partnership with our regional partners, the City of Mississauga, the City of Brampton, and the Town of Caledon, with support from Peel Public Health. We thank each of you for this collaborative opportunity to deliver this timely and important webinar for businesses and workers in the region of Peel. So before we get started, I'd like to quickly review the virtual event protocols we have in place. All attendees will remain on mute as we are recording this event. A Q&A session will occur after our guest speakers each present today. If you have a question, please use the Q&A button at the bottom of your screen to enter the question, and we'll do our best to get to as many questions as possible. The questions themselves will only be visible to MBOT staff and panelists. MBOT staff will review the questions that are asked, and I'll do my best to have as many of your questions answered. In fact, it's going to be my colleague Brad Butt who will be moderating the Q&A session. Now to introduce our guest speakers today. Dr. Lawrence Lowe is the Medical Officer of Health. I'm sure you're all aware of that for the region of Peel Public Health, and is also adjunct professor at the Dalla Lana School of Public Health, University of Toronto. He completed undergraduate training and medical school at the University of Western Ontario and residency at the University of Toronto, during which he also earned a Master of Public Health at Johns Hopkins. He is board certified in family medicine in Canada and in public health and preventative medicine in both Canada and the United States. Jonathan Borrelli is the lead of KMB's Employment and Labor Practice Group. He advises on all employment matters in Ontario workplaces. He and his team provide strategic day-to-day advice for small, medium, and large businesses on hiring, firing, health and safety, accommodation, and much more. He also represents employers in wrongful dismissal matters, human rights litigation, and related employment litigation. Please join me in welcoming both Dr. Lowe and Jonathan Borrelli. Right now, I will turn it over to Dr. Lowe.
Thank you very much for that warm welcome, Trevor, and it's a pleasure to be here again with you and Jonathan and Brad and all of our friends from the Board of Trade, as well as the business community here in the region of Peel. I will be sharing my screen momentarily, so just bear with me for a moment. And I have a bit of a presentation that I will walk us through at this time. So just moving on then, as a bit of an agenda for today's talk, we will be talking a bit about the current status of the COVID-19 pandemic in Peel, current public health measures that have been put in effect by the provincial government, the perspectives on the Omicron surge, and then related to that, how approaches are changing in respect of workplace outbreaks, cases, and investigations. And finally, I will be sharing just some information from our other business units within the region around new business supports that are available. And while I'm not able necessarily to speak to the details of those supports, there will be information and a website for you to review should that be of interest in determining eligibility. To just move on to the status of the COVID-19 pandemic in Peel, we are in the midst of a transition period owing to the widespread transmission of the Omicron variant in our community. Because the Omicron variant, which was first identified in South Africa in November, is so very transmissible, this has necessitated a shift in our approach to addressing the pandemic in our community. I think given the levels of transmission that we've seen in our community in the past few months, we've seen a major change from the time where Delta was the circulating variant and subsequently Omicron, which really took off in the midst of December. With Omicron now being significantly widespread in our community, this has necessitated a change in our overall response to really focus, certainly while we're trying our best to mitigate and limit and reduce the spread and infections that are occurring in the community, our primary focus is shifting to trying to prevent severity as much as possible, particularly amongst vulnerable populations. Due to the situation as well, the traditional cascade of testing and tracing has had a limited value and utility, just given how widespread Omicron as the more transmissible variant has unfolded within our community. And that has resulted in eligibility changes in respect of testing, as well as changes in provincial direction around areas to focus on for contact tracing and outbreak investigation, which primarily is now focused on our highest risk settings, where the most vulnerable are at risk of severe outcomes. We are also, as a result of this change in approach, shifting the indicators that we monitor to really determine what the picture of COVID-19 transmission is. And at this point in time, we are continuing to track community activity through things such as our wastewater signal, test positivity, and percentage of high-risk settings that are in outbreak. And then, of course, we are focusing on severity of illness and health system capacity by monitoring healthcare system indicators such as hospitalizations, intensive care unit demand, as well as hospital bed occupancy. Given all this, we can tell you that the transition, this period of transition in transitioning our approach is also allowing us to see from our wastewater signal that we have hit a plateau and are starting to see a slowing of transmission just recently in the past few days within the region. And while this trend is favorable, it's important for me to note that current rates of transmission still remain higher than at any other point of the pandemic. Fortunately, we have seen that even with Omicron circulating as far and wide as it has been, that residents who have received at least 2 and even better with 3 doses of vaccine are experiencing mild illness with Omicron and a significant diminished risk of severe outcomes such as hospitalization or death. At this point in time, the region of Peel has 89% of our 5+ population with at least 1 dose of vaccine and 83% with 2 doses, which is higher than the provincial average. In general, our focus, especially as we move towards reopening and in trying to prevent severity, besides just focusing our testing and tracing and outbreak investigation efforts on high-risk settings, is really to try to encourage our residents as much as possible to get their first, second, or booster dose of vaccine. So we encourage everyone, of course, to book online on our vaccine portal at peelregion.ca/COVID-19 vaccine, or also on the provincial booking system. We're also accepting walk-ins for any resident over the age of 5 who needs their first 2 doses, or any resident over the age of 50 who needs a booster. And at this point in time, the preferential recommendation for those between the ages of 18 to 49 to hold off on their booster has been reversed. We are now encouraging all residents over the age of 18 to access a booster as soon as possible, because again, the data is very clear that 2 doses are good, but 3 doses are even better, especially with Omicron circulating and especially with reopening on the horizon. Vaccination still remains the cornerstone of prevention of severity in our continued change, in our continued response, regardless of the change in approach. So I do want to touch on the current public health measures. As you know, the province moved Ontario into a modified stage 2 on January 5th out of an abundance of caution, and has announced that a phased easing of those restrictions will begin on the 31st of January. This will include lifting of capacity limits gradually in many different sectors, as well as the reopening of certain high-risk settings where vaccination certificates are required, including restaurants and gyms. The province is emphasizing that they are taking a cautious approach, so we do understand that there will still be some measures in place through the coming months. And we also know that proof of vaccination requirements will continue to apply in settings where it is required. At this point in time, the definition of complete vaccination for the purposes of the proof of vaccination is a 2-dose series at this point in time to enter these settings. However, it's incumbent upon me to really highlight the value of still getting a booster, even if the proof of vaccination does not necessarily require it. It is clear that while 2 doses are good against severity, they're not that great against preventing infection alone, and a booster does help to augment active immunity to really strengthen an individual's protective effects against the virus. The province also continues to encourage remote work where possible, and this recommendation is in place just for the duration of the surge while Omicron is coming out of its high levels of transmission that we're at right now. And we encourage any employers with any questions around the provincial reopening plan or impacts to business to call the Stop the Spread business info line at 1-888-444. 3659. That's the number in front of you there, and certainly can be searched for on most search engines as well. In terms of this point of transition, it is really helpful for me, I think, to provide a little bit of context in terms of what this shift is. And it really is shifting from containment, which is a singular focus in preventing infections, to mitigation, which is while you do try to reduce the impact of infections as best as possible, you really are trying to prevent severe outcomes as much as possible. And we do recognize, especially with the Omicron variant and our high levels of vaccine coverage, that boosters are critical, getting people with 2 doses up to 3, and then also protecting those who are unvaccinated, especially those who are vulnerable. And we're also really, really prioritizing boosters for those populations that may see their immunity wane more quickly, such as those that are older in our community, those with immunocompromised, those that live in long-term care settings. This overall shift in approach is also what has necessitated the ministry's direction to focus on high-risk settings for outbreak investigations. At this point in time, we are no longer undertaking workplace exposures and outbreaks within workplaces in the region of Peel. The responsibility to maintain occupational health and safety has now reverted to employers under the Occupational Health and Safety Act. This is largely, as I mentioned, because of how widespread Omicron has become. It has now become part of the broader community milieu, and together with the context of high vaccination rates in our community, it's incumbent upon workplaces to really look at policies that protect individuals through things such as vaccination or exclusion in the event that someone is sick, in accordance with an assessment of risk by their occupational health and safety associates or teams, and to really do their part under the Occupational Health and Safety Act to resolve concerns around COVID-19 in the workplace, which is now widespread throughout the region of Peel. In view of this provincial direction, Peel has also rescinded our previous Section 22 class order on workplaces, which eliminates a lot of the additional requirements that were in place for reporting to public health. Again, a focus now being more internal to your workplace safety policies to ensure that you are doing what you need under your mandate as an employer to protect your employees based on evidence that is available around exclusions and vaccinations and masking as well. So the question may then arise, if an employee does test positive, what are some responsibilities that still remain in place? Workplace employers are required to notify the Ministry of Labour within 4 days and to notify WSIB within 72 hours of a positive test at workplace. And then certainly in recognizing the internal nature of the responsibility to also notify health and safety representatives and the employee trade union if applicable. Unless you work or unless your place of employment has been identified as a high-risk setting under the ministry's direction, there is no longer any need to report a positive case to Peel Public Health. Our focus is at this time very much seized on our high-risk settings, such as hospitals, long-term care settings, congregate living settings, etc. Peel Public Health continues to be notified of positive PCR tests that are detected with individuals at high-risk settings. And those individuals are then contacted through our usual processes to ensure that we are preventing severity in the highest risk settings in our community. But those who do not work in a high-risk settings should continue to follow provincial direction on self-isolation and notifying close contacts, as well as any other employer policies that may be in force, depending on the risk assessment that's been undertaken by the Occupational Health and Safety Department within your organizations. In respect of changes to testing and isolation, as mentioned, we are now prioritizing PCR testing in accordance with provincial direction for high-risk settings and populations. There is also a rapid test program that the province is currently administering. We recognize and have heard that demand for these tests are high and that our provincial partners are aiming to address that demand as quickly as possible. The tests can also be purchased online through private suppliers, and it's important for me to make very clear that Peel Public Health does not administer the rapid test program, and we do not have supplies of rapid tests for broad distribution to the public at this point in time. What should undergo if an employee tests positive with a rapid test or has symptoms? At this point in time, because Omicron is so widespread in the community, if someone has mild symptoms that are consistent with COVID-19, no test is required. They should stay home, and members of their family should also, in the home that they live in rather, should also stay home. They can use the provincial screening tool to determine the length of isolation. And they may consider advising close contacts if they know of someone who they've been in close contact with that they may wish to let know that they are sick. In the event that an employee has symptoms, we ask you to send them home if they have tested positive or have symptoms and are at work. We ask you to direct them to immediately self-isolate and follow the instructions as per the provincial direction that is available. And then it would be up to your workplace to determine what measures, if any, within your policies and occupational health and safety risk assessment would necessitate close contact notification within your workplace. There is a template that is available on the provincial website and also on Peel Public Health's website that can be modified to fit your needs in order to notify staff within a workplace of a case of COVID-19. And you can also visit covid-19.ontario.ca/exposed. Again, that's covid-19.ontario.ca/exposed, the URL that you see there for resources and further information on steps that your workplace might take in the event of a positive test at the workplace. Finally, in respect of employees returning to work, at this point in time, provincial guidance is clear that employees do not require any tests or letter from a doctor or medical documentation in order to return to work if they have completed the required isolation period and their symptoms are improving. PCR testing is not available for individuals who are seeking to return to work, so we urge employers to change that policy as much as possible. Both Peel and the province do not support any test clearance to return to work, or return to work letters, or return from isolation letters at this point in time. If someone is feeling well and their symptoms are improving and they've completed the required isolation period, they can return to work, obviously with the additional measures of masking and other steps that may be taken within that workplace to continue to provide additional layers of protection in accordance with your occupational health and safety risk assessment. Finally, just sharing as well, as mentioned, that the Region of Peel has created resources to support workplaces. You can visit peelreach.ca/coronavirus/business. We have updated a final guide to managing COVID-19 exposures in the workplace. This was developed by our outbreak section to assist workplaces in this time of transition in navigating COVID-19 exposures on the site. However, we urge you going forward to continue to regularly check the provincial website for more up-to-date information. However, we do have this final version of guidance that we are providing during this time of transition to employers, which is available at that website. And we do want to call to your attention the rebate and relief programs that are both linked on our website. Should it be applicable for your businesses in trying to get through this what is hopefully a final transition out of the acute phase of the pandemic. So with that, I'll just again highlight that we are happy to answer any questions that folks may have during this time of transition. And you can also visit our website for resources and further information as this approach shifts and what it means for you and your business in terms of continuing to address the risk of COVID-19 in your workplace. Thanks so much, and I'll pass it back to, I guess, Trevor and Jonathan. Thank you.
Great. Thank you, Dr. Lowe, and thank you again for doing just such amazing work at Peel Public Health. And of course, nobody anticipated or wanted for you to be focusing on this issue for so long. And we really appreciate all that you're doing. We will take questions after our second speaker, Jonathan Borrelli, who I'm pleased to introduce now. Jonathan.
Good afternoon, everyone. Thank you for having me here. Good afternoon, Dr. Lowe. It's good to see you again. I'm an employment lawyer here at KMB Law in Mississauga. And before I begin, I really wanted to stress something Dr. Lowe said. He said, that it's reverting back to employers, doing their internal work to make sure they are complying with the Occupational Health and Safety Act. But I really want to confirm that ongoing obligation for employers, it is ever present, it is there, it exists in the law. And the Occupational Health and Safety Act says employers must take every reasonable precaution to protect workers in their workplace. So that exists before the pandemic, it's happened during the pandemic, and it will be there afterwards. So it's important that employers know their obligations, in addition to what public health says and the ministry, any ministry says, they have an ongoing obligation to protect workers in the workplace. I want to talk about two things today. I want to talk about blind spots that employers should know about when they're reopening, specifically with their vaccination policies. And then if there's time, of course, I want to leave time for questions. I want to talk about the different ways that courts and arbitrators have specifically commented on certain employers' vaccination policies. That seems to be the most recent updates to the law. So first, I want to talk about the blind spots. So I've collected a list here, and I think it's important that employers take note of these things. So number one, I think employers should they should be constantly reviewing their policies, but they should review what their definition of vaccinated means. If the definition was created, let's say in August 2021 or April 2021, that may have changed. And so I would recommend, matching the definition for what it means to be fully vaccinated to match whatever the public health says or the Ministry of Health says. That's an important factor in any vaccination policy. And of course, every employer needs to have some sort of vaccination policy. May not have to require vaccination, but they have to address the topic of vaccination. That's legally mandatory. I think it's important for employers to engage with their health and safety reps, and if they have it, the Joint Health and Safety Committee. It's important to constantly engage with them. There are plenty of health and safety issues happening now, and also document those actions in the event that the Ministry of Labor wants to investigate whether or not the employer's been complying with their obligations with regards to Joint Health and Safety Committee. What I always tell employers, it's a new year, review your policies. There are some policies that have to be reviewed annually, specifically a harassment policy, a violence policy, probably your accommodation policy as well. So it's a new year, make sure you review all of your policies going forward. There have been some newer changes to the law recently, including the right to disconnect and some other changes. So it's important to stay up to date with any changes that have been happening. And specifically with regards to vaccination policies, like I said, it is mandatory to have a vaccination policy, a policy that addresses vaccination, not necessarily mandatory vaccination. But it's important that that policy addresses that workplace's particular issues and situation. A policy that may apply for one employer may not necessarily be applicable to your workplace. So it's important to apply the circumstances of your workplace to your vaccination policy. I think it's also important that vaccination policies are flexible. And I think, like I mentioned before, policies are constantly being updated, or they should be constantly updated, and they should, they're flexible things, and they are subject to change, of course, as circumstances change. So if it's reasonable for a policy to be updated, that policy should be updated. If it's reasonable for the policy to be updated immediately, that should be done. If the policy should be updated, but perhaps with some lead time, some notice to employees. Let's say you're moving from we don't require vaccination to we do require vaccination. I think part of that flexibility is making sure that employees have enough notice and time to be able to comply with any changes to any policy. So it's important to have a strategy when new policies or updated policies are going to be performed and implemented in the workplace. A good vaccination policy will discuss the consequences if an employee cannot comply with it. Any good vaccination policy is going to do that. There are a variety of different things an employer could implement. It could be discipline. There may not be discipline. It could be a paid leave of absence. It could be an unpaid leave of absence. That could potentially, under certain circumstances, it could lead to a termination. Termination with cause, termination without cause, with notice, without notice. There are a variety of different consequences that could be in any vaccination policy. And it's important to explain exactly what those policies and consequences are. And as I said, if there are more significant consequences, you may want to provide employees with notice of those changes coming through. I think it's also important, to address testing and address any costs of any employee's compliance with any policy. So, in the fall and winter, in the fall of 2021, we were talking a lot about testing and rapid testing. And I know MBOT and a lot of different chambers of commerce and boards of trade around Ontario were giving out free rapid tests, in the fall. Of course, that's not the case right now. There is a dearth of rapid tests available. And of course, the provincial guidelines on PCR testing have changed as well. So again, if your policy mandates testing and you aren't able to test currently, you should review, update that policy to make sure the policy is in line. But if you do require some other type of requirement, let's say it's a doctor's note, if someone needs a time off for an injury not related to COVID, let's say, the employer should bear those costs. But I will also note, if an employee has COVID, they are not required to get a doctor's note to get time off or to be away from work or to request any other accommodation. If someone can work from home and they say they have COVID, but they can properly self-isolate and work, then the employer should look to their policy, and they probably should look at the flexibility in that policy and allow that for that employee. but an employee does not need a COVID test to be excused from work or to return from work. Right? And I think that's been made very clear by the province. It's been made very clear in public health and other guidelines, and the employer's policy should reflect that as well. And the last thing I'll say about vaccine policies in general, it supplements every other policy that an employer has. So the vaccination policy is one policy. There should be a policy on social distancing, physical distancing. There should be a policy on screening, and it should be very clear. Screening is still mandatory for every employee who enters a workplace, right? And those rules have not changed since the spring of 2020. So we're coming on about 2 years of that. So the vaccination policy is one policy within, the variety of tools that an employer has in their tool belt to make sure, as I said before, to take all reasonable steps to protect employees or all workers in the workplace. So that's what I wanted to draw attention to in terms of the blind spots and where I see some employers having a lot of questions with. I was going to go over the newest changes to to what's going to happen next Monday and after that, but in the interest of time and to save time for questions at the end, I'll leave that. But I think it's important. Employers should know, exactly how the province is, going to slowly, cautiously reopen. And I will echo what Dr. Lowe said earlier. There are three special programs right now for businesses and small businesses related to cost rebates, small business relief grant. There's a cash flow improvement for Ontario businesses. So I think every employer should avail themselves of those programs. They're brand new. Some of them just, applications for this business cost rebate program opened on January 18th. So it's brand new programs. I think every employer should look into that. But now I want to talk about the vaccination policies in a little more detail, because as I said, it is mandatory for an employer to make a statement, have a policy regarding vaccinations in their workplace. A lot of employers have specifically included that employees must show proof of vaccination. And then there are certain consequences for that. So courts and labor arbitrators in the unionized environment have reviewed, they've criticized, they've upheld, they have not upheld certain vaccination policies and other related policies. So I want to go through and just highlight which policies have been upheld and why they were upheld. Overall, the standard, as is the standard in a lot of different areas of the law in our society, is reasonableness. A reasonable policy is going to be upheld by a labor arbitrator. It's going to be upheld by a court, the Ministry of Labor, if the policy is reasonable. Of course, that's quite general. What is reasonable depends on every single workplace. So for one unionized environment, it was like a security guard type of workplace. The collective agreement specifically had language that said that the employees would agree to obtain vaccines. So some employees brought a grievance and they said, well, we don't want to have to comply with the mandatory vaccination policy. The arbitrator upheld the policy because it was consistent with the terms of the collective agreement. So I think the lesson there is, of course, I think any employment agreement or collective agreement should be very clearly written out. And non-unionized employers can consider having a clause in their contracts regarding vaccination. And the employee can agree to that as a condition of their employment. In another arbitration decision, and this related to Maple Leaf Sports, so Air Canada Centre, the Scotiabank Arena, my apologies. And the employees there argued that they shouldn't be required to disclose their vaccination status because it's confidential health information and it was not reasonable. But another labor arbitrator found that disclosure of the vaccination policy was reasonable. And actually that arbitrator said being vaccinated was a necessary job qualification to work at somewhere like Scotiabank Arena. And specifically, that arbitrator drew attention to their workers had to work in close proximity to other people, and the information was going to be kept confidential. So mandatory vaccination policies are being upheld. There was another case recently out of Hamilton, and that labor arbitrator upheld the mandatory vaccination policy for a variety of reasons. Number one, the Hamilton Port Authority, which operates the land where that employer was located, enforced a mandatory vaccination policy. So the employer had no choice. And other reasons, rapid testing would not be appropriate in that circumstance. It was either show proof of vaccination or you can't work. There was no middle ground. And remote work was not a viable option as well. But I think most importantly, the arbitrator in that decision said that the public health and safety interests were significant and they outweighed the intrusion on privacy. And actually that arbitrator called that intrusion minimal, the intrusion on privacy minimal. So again, mandatory vaccination policies, they are being upheld by the vast majority of labor arbitrators. There has been one decision, which I won't go into great detail of, but a labor arbitrator struck down a secondary version of a vaccination policy because it went a little too far than the first vaccination policy. But that arbitrator still said that generally a mandatory vaccination policy, of what that's reasonable, would be upheld. Testing, that was more of an issue, like I said, in the fall of 2021. Right now, of course, we can't really require employees to get rapid tests, but workplace testing has been upheld as reasonable, and it's really dependent on the facts of that specific employer. At a retirement home, it was found to be reasonable. At a food processing plant, it was found to be reasonable. At a construction project, it was found to be reasonable. So depending on, and again, it goes to, I think, where I started at the beginning, where a policy is reasonable, it's going to be upheld by labor arbitrators and very likely the court. The last thing I want to touch upon, and I do want to leave time for questions, is dealing with employee misconduct and the other ways that employees in some specific situations are dealing with the vaccination, integrating with the vaccination policy and dealing with it. So first of all, there was one a unionized employee who said that wearing a mask was against their religious beliefs and didn't want to comply with a mask policy. And that grievance was thrown out because the labor arbitrator found it was reasonable to uphold a masking policy. There was another employee where he would not properly complete workplace testing. Workplace screening. So an employee would repeatedly, he would just simply lie on workplace screening. He would avoid it. And when he did have symptoms, he would go into work. And of course, the employer assessed the situation and terminated the employee. That employee grieved the decision through his union, and the dismissal was upheld. That labor arbitrator found that it was appropriate if someone was repeatedly, avoiding screening and lying on screening for COVID symptoms before work, it was appropriate to terminate. There have been some other issues related to human rights and the Human Rights Tribunal, and the Human Rights Tribunal has started to address accommodation for certain disabilities and how it interacts with vaccination policies. So we're still waiting to see, more cases come out from the Human Rights Tribunal, from court, from labor arbitrators going forward. And I constantly keep everyone updated as much as I can. I know with MBOT we do some regular podcasts. So what I'm going to do, I'm going to stop right there. I have some other comments, but what I'd like to do is we can open up the floor to questions for the last section of the webinar today for myself or for Dr. Lowe.
Well, thank you very much, both Jonathan and Dr. Lowe, for, of course, joining us today, giving us the benefit of your expertise and your knowledge. As we all know, with the COVID situation, it's ever evolving. Things change, and policies, regulations, and even public health guidelines do change periodically. And what we're trying to do today, obviously, is to help businesses to operate properly for the protection of their own businesses, their employees, their customers, and of course the community at large. As you can imagine, anytime we have the Dr. Lowe and Jonathan Borrelli show, we get lots of questions coming in. So I'm going to go through them in chronological order as they came in, gentlemen, and then I'll just have you guys pipe in as to whoever thinks the question is directed at them, or they can offer anything else. Just to remind people, the Q&A button at the middle bottom of your screen. If you do have a question, we'll try and get as many in as we can in the next sort of 15 minutes, and then we'll be closing it off. So let's start. This is probably for you, Dr. Lowe, the first one. Is it true that procedural masks must be ASTM level 1 at a minimum to be effective?
Yeah, it's a great question. So the Public Health Ontario guidance is actually pretty clear. They say that it is less about the type of the mask, but more about fit. So really ensuring that it's got a fit, a good tight seal around the mouth and the nose. Unless, of course, there is an operational requirement for a different mask. So certainly in certain settings and certain high-risk settings, they've mentioned operational guidance that requires a higher grade of mask. But in terms of masks, it is really about, in most typical low-risk workplace settings, it is about making sure that you have a well-fitted mask at this point in time. It's also important for me to highlight that masks are really only one piece of the puzzle. In general, it needs to be a multi-layered approach to prevention, and that includes, for example, ensuring that people are vaccinated, ensuring that people who are sick are excluded from the workplace, ensuring that you're improving ventilation where it may be possible, especially in areas where ventilation is poor. All of these things are, together with the masks, are meant to actually provide multiple layers of protection, both to help reduce the risk of infection and where infection does occur, to diminish the risk of severity altogether.
Just a quick reminder on face coverings. I know that there was some media that the Premier was musing about when mandatory face coverings would end. Regardless of what the province does, I think it's important to remind people, the City of Mississauga, for sure I know, and I think Brampton and Caledon are the same, they still have mandatory face covering bylaws till March 31st. Of this year. So regardless of what you're hearing, there still is municipal bylaws that mandate face coverings in indoor settings until at least March the 31st. So that should be important for businesses in the region of Peel to know. Next question. If an employee is presumed positive based on symptoms and self-isolates, but hasn't been able to access a test, does this have to be reported to the Ministry of Labour?
I can address that. So, with the most recent changes that came about at the beginning of this month, no, an employer is not required to report an employee's. Let me see the question here. If someone is presumed positive, no, they do not. That does not have to be reported to the Ministry of Labour or to Public Health. And like Dr. Lowe mentioned at the beginning, Public Health is focusing on high-risk settings, and but it doesn't excuse an employer to internally create all their follow their own policies, document that, and treat that information as per their policy. So it doesn't have to be reported to the Ministry of Labour, but the employer still has obligations.
Okay, thank you. And Dr. Lowe is doing lots of nodding, so it's always great to see when you two guys. Great. Did you want to add something, Dr. Lowe?
Yeah, if I could add on to Jonathan's great answer, I think the other piece is, again, it goes to the idea that if there is a presumed positive that comes to the attention of the employer, it's up to you, I think, to make that risk assessment to see, was this person at the workplace sick? May they have exposed people, etc. And then that will determine your actions in accordance with the reporting requirements that Mr. Borrelli was speaking to.
Okay, another one on positive testing. Let's say a worker has tested positive, has completed their isolation period, and 2 weeks later, a member of their household test positive, I think we're hearing a lot of these cases these days because of Omicron, do they need to isolate with everyone in their household again?
So the Ministry of Health guidance is currently being reviewed and updated at this point in time. According to the current guidance, the answer is yes. Everyone in the household would be recommended to isolate again. However, there is a recognition that many people in the household, certain people are contracting respiratory diseases at different times, and typically it may be COVID at different times, or it may be other respiratory viruses that are circulating during the winter season that is presenting some difficulty for individuals. So I do know that there are other provinces and jurisdictions, British Columbia comes to mind, where it is now pretty much not household. It is, if you feel well, you can go. If you don't feel well, you stay home, typical to the advice that was given pre-pandemic. Ontario guidance is not there at this point in time yet, but as you know, the Ministry of Health is continuing to review the situation and may update their guidance, particularly as we move towards reopening.
Okay, if an employee tests positive for COVID, but contact tracing is completed and determined it occurred outside of work, is the employer still required to report that to the Ministry of Labor and the WSIB? Do you know that, Jonathan?
Sure, yeah, I can address that one. So an employer is required to report to the Ministry of Labor or WSIB if the transmission happened in work, at the workplace. And there's other requirements for reporting it to the Ministry of Labor or WSIB. So I would say in this very specific question, no, an employer would not be required to report to the Ministry of Labor or WSIB. But again, the employer should still take all the precautions under their policies.
Can an employer permit an employee to work from home when they say they're well enough to do so, if they got COVID or are presumed to have COVID, or should the employer require the employee to take sick time in order to rest and recuperate? I know that there's always this big challenge about the work from home versus work in an office. And if you work from home and you have COVID, I guess you're at home, you're isolating. So any advice on that? Maybe Jonathan, probably.
Sure. I mean, there's two policies that apply to that, not just the COVID policies, which of course, should be detailed, updated regularly, but also the human rights and accommodation policy. If someone says, I can work, they're disabled, perhaps for a short period of time related to COVID, but I can still complete my job. I can complete part of my job from home, and I would like to do my job from home, maybe not for the whole day, perhaps half a day. Those are the types of conversations that the employee has to have with the employer. And really the employer should look to their policies on COVID, but also human rights and accommodation, because it engages both of those. So the answer is it may be, probably, I'd have to know more about the situation, but generally an employer can keep an employee out of the office, out of the workplace, if there's a concern they may have COVID or transmit COVID. But whether, if the employee can still do their job from home, that engages human rights. So, the employer may be required to allow the employee to work from home. It depends on, the wording of their policies related to COVID and human rights.
If someone's asking if a business needs multiple policies, a vaccination policy, a screening policy, social distancing policy, do they need multiple policies, or do they just need one, like really good one that covers all these things?
Yeah, the number of policies doesn't matter. You could have one comprehensive policy, it's 20 pages, let's say, or you could have each policy separated. But with those specific 3 policies that were mentioned, vaccination, screening, distancing, they are currently recommendations of public health. And there's a regulation that states if public health makes a recommendation regarding vaccination, screening, or social distancing, the employer must comply with the recommendation. And so do they have to have 3 policies? Yes. Could it be in one document? Sure.
Okay. In place of contacting public health, is the Ministry of Labor responsible for providing direction on close contact tracing and isolation requirements?
I can try to weigh in on that. No, I don't believe the Ministry of Labor would provide that guidance. And I think this is really where it's important for employers and for occupational health and safety leads to review the sector-specific guidance that is available on the Ministry of Labor's website. And then in accordance with that guidance, to institute policies and procedures as to how you will respond if there is COVID-19 detected in your workplace. Again, we're very thankful, at least from the scientific and the public health perspective, that we are seeing for individuals who are vaccinated with 2, even 3 doses, that the risk associated with severe outcomes with this disease has shifted significantly. And so that also may shift the nature of how you approach any sort of investigation. But ultimately, any sort of outbreak investigation, contact tracing, et cetera, that would be borne by the employer and their occupational health and safety leads in accordance with sector-specific guidance from the Ministry of Labor.
Yeah, and the only thing I would add to that, I agree completely, is like I mentioned at the beginning, an employer has a legal obligation to take all reasonable precautions to protect worker safety, worker health and safety. So if the contacting the ministry and public health or WSIB is, should be part of that policy, should be part of those reasonable precautions that are taken. And so, I advise employers follow your policies.
Okay, can you provide insight? I know you did touch on this earlier, I think, Jonathan, but let's do it again because folks need good guidance. Can you provide insight when employers are required to implement a mandatory vaccination policy? The questioner is saying, my understanding is this type of policy was voluntary as long as employers had all other COVID-related policies and safety protocols. Do you want to weigh in on that?
Sure. And when it came out around the late fall, I really took time to clarify in other webinars and for our clients, the policy is mandatory. What is detailed in the policy is up to the employer. So if the employer chooses, so the answer is yes, it is, forcing employees to show proof of vaccination, that is voluntary. But every employer must have at least a statement or a policy on their, position on vaccination. So the policy could say, we don't require it because we do all these other things. And a judge or a labor arbitrator might, criticize and critique it because they're going to ask if it's reasonable, considering everything in that workplace. Or it could be on the other side, and it could be, yes, employees must show proof of vaccination, otherwise they're on an unpaid leave of absence. So the mandatory aspect relates to the document, relates to the policy. What's in the policy is up to each individual employer.
So there's a couple of questions in a row here that deal with a mandatory vaccination policy within a company. Number one is, if you have one, can you mandate or require every employee to show you proof that they have been vaccinated, either through their QR code or the actual form that they get? And the other question is about those who are working exclusively from home. So if they are not working in the workplace, would a mandatory vaccine policy apply to them?
Yeah, I think the answer, and this is the typical lawyer answer, is it depends. It depends on whether the policy is reasonable, right? If the employer wants to implement a policy, and the employer feels it's reasonable, and the employer requires every employee, regardless of where they work, if they work from the operation, if they work from home, they require every employee to do that. If they feel that's reasonable, they can do that. If the employer says it's not reasonable to ask someone if they are 100% working from home, sure. But I think the other questions employers ask themselves is, if that employee working from home, will they ever have any, interaction in person with a client or customer going forward? If the answer is yes, I think an employer could make a case to say, well, there is a chance that on behalf of the employer, they go out into public outside of their house. So it may be reasonable to require, remote employees to show proof of vaccination.
Here's a question for Dr. Lowe about Omicron. What is the data on reinfection? Are doctors and other health professionals, are you seeing It may be too early, but you can answer it. Or a second or third time where people are, because it's so highly infectious. Maybe just give us an update quickly again on Omicron, Dr. Lowe, and where things are and infection rates, and are people getting it multiple times?
So Public Health Ontario's most recent assessment of Omicron, which came out, which they've been issuing on a weekly basis, says that the risk of reinfection is high with a low degree of certainty. And that's on the basis of international data that is showing that a number of individuals have reported reinfections with Omicron in settings such as Western Europe and in South Africa, which are ahead of us on the curve. But what is more important and what is more key, especially with the shift in approach to preventing severity, is that those that are reinfected with Omicron who are vaccinated almost always continue to have a less severe presentation of disease, which really underlies the importance of ensuring that people are vaccinated with 2 doses and boosted where possible.
Okay, we've got time, I think, for probably 2 more questions, and then I'll be turning it back over to Trevor to wrap up. Someone's asking about Ontario Regulation 26320, where businesses and organizations must make sure that all work is conducted remotely unless the nature of work requires the person obviously to be on site. Is this a legal requirement, Jonathan, or is this just a general guideline?
I think that question refers to like the step 1, step 2, step 3 back from 2020, which, it has been updated over time. And I think it also relates to the government's guidance recommendation at the beginning of this month, where they said, if an employee can complete their work from home, yes, they should complete their work from home unless the employer requires them to work from the office. So if it's in a regulation, I would say it's a legal requirement, but I'd have to look very specifically at that particular regulation. But the government made it very clear at the beginning of January 2022, if an employee can work from home, that employee should work from home. If they can work remotely, if they're required to be on site, then, and again, this comes down to the employer's policies, and they should, probably identify which employees can work from the office, can work remotely, and implement those regulations. So if it's in a regulation, it's the law.
Okay, and the last question I'm going to ask to Dr. Lowe, because somebody's asked about ventilation. And of course, many of the people who are on this call today will be owners and operators of businesses. They obviously all have HVAC systems in their place of business or some sort of air circulation. Does Peel Public Health, or maybe even the Governor of Ontario, is anyone looking at new ventilation guidelines? We've heard a lot about, the HEPA filters in the schools and other things. Is there any talk about issues around ventilation in businesses, in workplaces, and any new guidelines that perhaps would be coming down the pipe?
So it wouldn't be any guidelines from Peel Public Health. At this point in time, we are really staying in line and aligned with the Ministry of Health's direction around our focus on high-risk settings. But we do know Public Health Ontario and the Ministry of Health and the Ministry of Labour continue to look at the ventilation question. And if there are to be any standards to come out, it would likely be from the provincial level. I think at this point in time, the scientific advice is, where possible, fresh air is a good thing. And there's an opportunity to really either, through the HEPA filters with various standards as put forward by ASHRAE that are already in existence, or in simply just opening a window if the weather outside is mild and permits it, that can help to really ensure that air is not stale and not circulating.
And the last thing I would add to that, there are certain professions. I know for dentists, they have very specific requirements about ventilation in each operatory, in every place where where you're sitting in the dentist chair. And a lot of people probably see, since they've been to the dentist, more ventilation in dental offices. So that's very, very sector specific. Yeah.
Okay, listen, thank you very much. This has been an excellent Q&A portion of today's event. Thanks again to Jonathan Borrelli and Dr. Lowe for taking those questions. I'm sorry we didn't get to all of them. We got a little bit inundated, but thank you for those questions, and we'll continue to keep people informed. Having said that, back over to Trevor McPherson to wrap us up.
Thank you very much. And Jonathan, Having been to the dentist recently, I can attest that it is a different experience, but it's a reassuring experience. So yeah, we have to continue to use every tool. I want to thank both of you, Dr. Lowe and Jonathan, for sharing your expertise and some very valuable and timely information with us today. On behalf of the City of Mississauga, City of Brampton, Town of Caledon, Peel Public Health, and the Mississauga Board of Trade, thank you everyone for joining us today. As we look forward to the reopening of many businesses on January 31st, coming up very shortly, please know that the Mississauga Board of Trade, with the Chamber Network across Ontario, continue to advocate to the provincial and federal governments for transparent database policies as this relates to public health measures that affect your business. Let's hope we're getting out of the final lockdown and moving towards a much better remainder of 2022. As always, we wish you good health, continued and ongoing success in your businesses. And please, as Dr. Lowe implored us all, use every tool in the toolbox and get your booster shot for your own protection, for that of your family, the community at large, and to protect our hospital capacity. Thank you, and this concludes today's webinar.